Hello, my name is Crystal. I'm a nurse with Providence Hospice, and today I'm going to demonstrate for you how to draw up liquid medication. Sometimes towards the end of life, the liquid medication is used for the controlling of pain or just another comfort medication. Common ones used are morphine and acetaminophen. So today I have two 1 ml syringes, some water with blue food coloring so that we can see as we draw up. I'm going to show you how to drop the medication. Now, dosing is different for each person and for each situation, so make sure you check with your doctor or your nurse before you administer a dosing of some medications. Today, I'm going to draw up 0.5 mils of a solution so that you can see what that looks like. Supplies you will need include the medication, syringes, a clean working area, something to wash your hands with like a hand sanitizer or actually wash your hands, and some gloves. So to start, again, make sure you know what medication you're giving, what it's for, and how much you're using. The next step would be to wash your hands. A good tip is to make sure that your hands are dry before you put the gloves on, or it will be very difficult to put them on. Look at the numbers on the syringe before you start, so you have an idea of how much liquid you want to draw up. And also notice that there are no needles involved with this drawing up. So if you have some liquid just here, you can insert the syringe into the liquid or use the adapter on the top of the bottle. So I'm going to drop a little bit more than my dose. So we're going to do a little bit past the 0.5. And I'm doing this because I want to make sure that I got all the air out. In this draw up here, we actually don't have any air in there. So what I'm going to do is I'm going to just go ahead and push the plunger back to the 0.5 and lift up the syringe to show that this is 0.5 ml dose of whatever medication you're giving. As you can see, the plunger is directly on the 0.5 line and it's full to the top. If there were to be air in the syringe, go ahead and see if we can draw this up again. You're just going to draw up the amount that you're going to use and tap the amount of air out of it. So as you can see, there's no bubbles, and we can go ahead and advance the medication to the dose we're doing. So here we would have a 0.2 milliliter dose without air bubbles. The next step would be to go ahead and give the medication to the patient. You can either hand it to them to do themselves if they're able to, or you just go ahead and slowly insert this into the mouth. The last and final step is to make sure that you document what medication you gave. It's important to remember how often you're using the dosing so that you can maintain the right amount of medication. You can put it on a notepad or write it on any of your hospice provided material. If you have any questions about what you've just seen in this demonstration, please don't hesitate to contact your hospice care team.